Hey everybody, my name's Joe. I'm a doctoral student studying clinical psychology, and this is Psych Made Simple. Today I wanted to do a full screen video and just talk about some of the reasons why we diagnose in psychology. I thought this is kind of an interesting question because you hear all these different diagnoses about like depression, anxiety, bipolar, and sometimes it might seem weird of placing all these labels on people or whatever. So I don't know. You can let me know in the comments if there's any reasons why you thought we diagnose, but thought I would, from a psychologist perspective, kind of give you a little bit of why we diagnose as part of, treatment, usually at the beginning of treatment and then proceeding with therapy based on the diagnosis. So I'll give you an optimistic angle and a pessimistic angle. And the optimistic angle is that it kind of helps the client put a label onto their experience, right? So if you say, hey, you have major depressive disorder, this is a form of depression, and you can explain it, it kind of helps them understand what's going on or why there are all these problems in their life that they might not have seen are connected if they didn't really understand what depression was. And in some cases, putting that label on can help to just explain to the client that this is a shared experience, right? That you're not the only person going through this, and sometimes that can be helpful for them to feel like their problems are more normalized. Sometimes we say it's like making it feel more normal, not like this is some very, very unique experience that is particularly hard to get out of or something like that. Like kind of the normalization helps it be like, okay, other people have dealt with this and been able to get through this problem. And then in some cases, I would say the diagnoses are helpful to help the client get into a patient role, sometimes we call it, and this isn't always helpful. We don't want to, it's different than being like a victim or something like that, but just putting in that patient role helps you accept treatment and be ready to accept help and accept whatever the treatment is. So similar to like if you go to a doctor's office and they say that you have this, form of the flu or whatever it is, and you need this treatment or you need this antibody to deal with this specific problem that you have in a medical setting. We like to think that in a therapy setting, giving someone that patient role, right, of you have this specific diagnosis and therefore this treatment, for example, cognitive behavioral therapy, this is the best treatment for that problem, and kind of equating it to the medical health setting can kind of help people be more ready and accept treatment, because sometimes people are kind of resistant, like, oh, this is all mental stuff, I can deal with it myself, but kind of giving it that problem label can help them get into that patient role and think of it more as like a medical diagnosis or similar, analogous to that. Now, the more pessimistic angle of why we diagnose is that, quite honestly, if someone is getting their therapy funded by insurance, then the insurance companies need a justification in order to pay for therapy. So if you go to a doctor's office and you have cancer, then the insurance will pay for treatments for cancer because the doctor signs off on you having cancer, right? But if you were getting whatever cancer treatments, but you didn't actually have cancer, then first of all, that wouldn't really make sense, but also the insurance companies probably would not want to pay for whatever those treatments are. And so that's kind of the pessimistic view of like, we kind of just do it just for the insurance purposes. And I will say that I think in a lot of contexts that might be true where someone is struggling and they might not perfectly meet the definition of a certain disorder, but we might give them a certain diagnosis related to that, and it's not like a misdiagnosis, in most cases, but sometimes you can say like other non-specified depressive disorder, where they don't fully meet the criteria for any of the disorders that are listed in the DSM, which is like the diagnostic manual, but they still are depressed, and let's still give them this diagnosis to be able to treat them. And one problem with that is that sometimes this does lead to kind of like over pathologizing of one's problem. So sometimes, if someone's like diagnosed in a hospital, things are busy or whatever, they have these mental health problems, they might get diagnosed with like bipolar disorder, and there's been no assessment to clearly get to that diagnosis, but they still get that label on them. That can cause problems where someone's mislabeled, right? And they're not really understanding why they received this label, or it's the wrong label and they're thinking about their problems in an inaccurate way. And then that's just something to be wary of if, as a client or as a therapist, it's like a new client-therapist relationship where the client used to be with a different therapist or at a different medical center or whatever it may be. Then it's just good to be aware that if the diagnosis that's on their record might have to do with kind of just giving something for insurance purposes. So, that's all I had to say in this video. I wanted to just give an overview of some of the optimistic angles and the pessimistic angles of why we diagnose. So let me know in the comments if you have any questions, or if there's anything that stood out to you, or if you have any other thoughts about, I thought that diagnoses were because of this reason, or whatever it may be. So hopefully you enjoyed. If you enjoyed, give it a like and subscribe for more similar content. And also feel free to let me know in the comments if there's anything that you are struggling with in terms of just understanding psychology and would like to learn more about, and I'd be happy to answer it for you. All right, thank you.